Hey everyone, good afternoon. County Executive Pat Ryan here. Thanks for making time to join us for the COVID update, Thursday, January 21st. Here is what's going on with COVID. We're going to talk about the state of the pandemic as well as where we're at with vaccinations. We do have some relatively good news to share in terms of vaccine doses and availability, so I'll talk about that in a minute. But first, let's talk about where we are with the pandemic and the public health situation. We are very much still in the second wave and either at hopefully the top of a peak, but continuing to see near record levels of total active cases in the county, although we did see a slight decline in the new case percentage, and I'll talk about that in a minute. So I'm hopeful and optimistic that we may soon begin to see this tick down, but that really rests in all of our hands in terms of what we do to make that happen. Starting with the numbers, though, we are at a total case count cumulatively of 8,559, with almost 229,000 tests administered, just shy of 6,000 residents recovered, and unfortunately, seeing the death toll just continue to add up and accumulate. In just the last 48 hours, 5 more Ulster County residents passed away. Just again, as a reminder, 7 weeks ago, on December 1st, we were at 101 fatalities. We're now at 182. So in less than 2 months, we've had 81 of our residents succumb, making this by far the most deadly period of the pandemic in the county. And God willing, that will start to slow down here. And we're doing everything we can to make that happen. In terms of the hospital situation, we're basically holding steady here. We have 33 currently hospitalized in Ulster County, 2 of them in ICU beds. And as you can see on the graph, it's been up and down, but generally increasing hospital numbers. We'll talk about the capacity in a moment, but ultimately we've got to work to get that hospitalization number down. That is also near record highs for us during the course of the last 10 months of the pandemic. Active case numbers, same here. We are at or near the peak level. We're at 2379 right now. Yesterday we set an all-time record, not the kind of all-time records we want to be setting for total active case count. But there are some signs that this may be starting to tick down due to people taking the precautions more seriously, and hopefully that continues. Where we're starting to see some of those signs for optimism is in the new case numbers that we're getting day over day, the number of new positive cases coming in out of those tested. So in the last 48 hours since our last update, we've tested 3317, and had 192 new positive cases. That puts us at a 5.8% new positive rate, 5.8%. Remember, a week, 2, 3 weeks ago, we were at or above 10%. So if we can continue to bring that new infection rate level down, that will allow us to bring the total active cases down, which will mean less people in the hospital, which will mean less people losing their life to this horrible virus, while we're in a race to ramp up our vaccination efforts, which we'll talk about in a moment. You can see here the long-term projections looking forward cumulatively. And again, this is a reminder to me that this projection is really informed by that new percentage rate. So if we can bring that down, that means the difference between 8,500 total cases in 2 weeks or over 12,000, and that is the difference of many lives. So please keep that in mind as you're continuing to follow the precautions and those the safety measures that we've been following. Hospital capacity, we're in pretty good shape here. Again, we were close on ICUs 2 days ago, but we can add more capacity there. Our hospitals can add more capacity there if needed. We're at 33 currently in Ulster County beds with COVID-19. That is down from 37. We were at 37 2 days ago. So we hope that that number continues to decline as the total infection rate continues to go down. Again, the same reminder as always, how do we limit this? How do we get this second wave under control? What can each of us do who often I can understand, feel powerless, or like the feeling that what I do individually isn't going to meaningfully move this. In fact, it does, and it has in the past, and if we continue to do it, will meaningfully impact the overall situation. Each one of our decisions to wear masks, to wash our hands and use hand sanitizer, to maintain distance, to avoid social gatherings, each of those things at the individual level with our family and our coworkers and so on has this ripple effect that either slows the spread or increases the spread. And we're beginning to see the signs of the numbers maybe coming down. So let's please keep that moving in that direction rather than the other direction. And please remind and encourage and, if needed, prod others to do the same thing. Because at the end of the day, until we get our vaccinations ramped up and the supply increased across the country, it will remain the case that the most effective tool we have to save lives of our neighbors are masks and distancing and the other precautions. So as we race to get more vaccines out, that still is the most impactful thing we can do. Shifting to that other piece of our response, and we knew that 2021 was going to be the year, at least the beginning of the year, maybe the first half of the year, of trying to turn the tables on this virus to take back some level of proactivity and the offensive and start getting the vaccine out and getting this under control. So that's what we've been doing here with our vaccination efforts. This week, Ulster County was allocated 1,000 total doses for across the county to be administered to those in categories 1A and 1B and 65 plus. As I've talked about before, we have 60 to 70,000 people eligible, and so the number of doses that we're getting compared to those that are eligible to receive them are just nowhere near what we need, but at least we are getting some. We received, the county health department received 800 of those yesterday, and today our point of dispensing site is running at near full capacity, and by the end of today we will have administered 800 doses to Ulster County residents in category 1A and 1B. Our team that's working there at the site, I want to thank them for their work, and we continue to get really positive. Just before this update, I got another call from someone who was able to get their 83-year-old parent an appointment in through the site. The site itself is going extremely well, smooth, safe, and fast, with no issues. And so as long as we can get the federal and state government to get us those doses, we are ready to receive them and get them out. In addition to the 800 at our Kingston point of dispensing site, our other pharmacies and partners in the county received 200, which is the remainder of that balance of 1,000 across the county. They are in the process of distributing that as well and working through that. We will very quickly exhaust, and you can again see that just in one day, not even running at full capacity, we were able to get those 800 doses out to our residents at the Kingston site. The good news that I alluded to and sort of hinted at early on is that through a whole lot of pushing and persistence and working to secure more doses for Ulster County, we were able to, late yesterday, secure 300 more doses for Ulster County, which is, it's not nearly enough, but it is really good news. That's 300 more people in those high risk and high importance categories that are now eligible to get the vaccine. So of the 300 that we received, 150 of them, half of them are being allocated for first responders and teachers. that are primarily in that 1B category, and then another 150 for our seniors 65 and up. So because we have the additional 300 that we weren't originally allocated, we now have a total of 1,300 for this week in the county, and that will allow us to now open up our second pod site and activate our second pod site again down in Ellenville. That will be happening on Saturday. So the Ellenville point of dispensing site will run on Saturday. And we are actually shifting the site from Ellenville Hospital to a larger facility at the Ellenville High School gym. So replicating what we've done at the Kingston High School gym, that will allow us to expand operations and scale that up not only now, but more importantly, going into the future. We'll still be very closely partnered with Ellenville Regional Hospital, and I want to thank them for their great partnership in making that site work and run and allowing us to staff that and run that smoothly. So thanks to Steve Kelly and team for that. For those that want to and are eligible to receive additional, those to take advantage of, those additional 300 doses, I'm sure you're asking, how can we do that? Because there are tens of thousands that are eligible and very interested in that. So here's what you need to do. It's relatively simple. The first step is really to make sure that you're signed up on our Ulster County list and our Ulster County portal. We've already had well over 20,000 people sign up on this. There are two ways you can do that. The easiest, if you're able, and the fastest is to do it online. If you're not able to do it online, you can call our Recovery Service Center or our Office for the Aging. I'll talk through that process here in greater detail in a minute. Once you sign up online, and if you've already signed up on our Vaccinate Ulster site, then you're good. You're already on this list. If you got an email from me late last night about things going on, that means you're on that list and you're already signed up. For everybody that is signed up there and meets this eligibility criteria, meaning either you're over 65 or you're in category 1A or B, you will get a link to your email to sign up for one of those slots. So as we open up the 300 additional slots for the Ellenville pod, look for that in your email, and it will be a first come, first serve as long as you're qualifying in that category. Obviously, there are, again, not nearly enough doses, and so I know that there will be many who will be disappointed in that they won't be able to get in this week. But it's at least some good news and some encouragement that with enough pushing and advocacy, we're able to get a little bit more, 300 more for us. And again, at every step of this, I will continue to do everything we possibly can, make every call that we can, and push everywhere that we can to get more vaccine for us here in the county, for our residents that desperately need it and want it. All that being said, we are still very much in desperate need for more vaccine. So I will continue to echo this message that we need more vaccine doses in Ulster County. We need them now. We needed them yesterday. We needed them weeks ago. And so I will continue to push on that. Looking forward, we do know from the governor's remarks yesterday that at this point, New York State is planning to receive about the same number next week as we did this week. That is discouraging because I continue to hope that week on week that will ramp up rather than staying even or even declining. But in terms of predictability, we are expecting New York State to get 250,000 doses next week, which would likely result in about the same allocation for us here in the county. I have a high degree of optimism and hope and confidence that a new administration in Washington, whose really number one pledge and number one priority has been to get this vaccination process and the entire COVID response in better shape and running more smoothly. I do have optimism for that. It's obviously not going to happen overnight, and ultimately while I'm hopeful that I'm also going to be watching carefully to see if this actually plays out on the ground for us here, and we'll be able to see the difference or not. And I'm looking forward to working and cooperating with the new administration, with our federal leaders, with our state leaders, to just do the right thing and get this vaccine supply ramped up and get it out safely, quickly, and equitably. For those of you that want to be vaccinated and want to make sure you are signed up to get the latest information and eventually, as we get more, to get an appointment, again, here's what you need to do. If you're able to do this on the web, that will be the fastest way and the easiest way. If you're able, you can go to vaccinateulster.com, vaccinateulster.com, or you can go to our COVID-19 portal and link to it there. You click on the button that says Vaccine Notification Request. That essentially puts you on a list to be notified when appointments are available for you, and also to get regular updates. So at least once a week, probably multiple times a week, either myself or our health department will be sending direct updates to everybody signed up there, just to let you know the latest as we know it, so that at least everyone has the same information. And please feel free, and please do share that with others, especially with family members or others who might not be able to access email or the internet, and share that information. I'm very mindful that there are many that aren't able to do it that way, so we have ramped up a few different other ways to get that information and to get signed up. For our seniors in particular, who we know may need extra help, our Office for the Aging has stood up more folks to be able to answer the lines there. The number to call is 845-340-3456. That's for any of our seniors in the county. And now anyone 65 and up is eligible, but once again, the supply is very limited. So please do get signed up, but then remain patient, and we're going to do everything we can to get this to you all as quickly as possible. For everyone else, the best way, if you don't have internet, is to call our Recovery Service Center. That's the general line where all of our services are available. That is 845-443-8888. We're still experiencing a very high call volume there, although not quite as high as 2 weeks ago. But please be patient throughout this process. I know it's difficult and frustrating, but I ask that everyone remain patient, keep perspective that we are making headway, that less than a year into this, it is nearly a miracle of science that we even have a vaccine in any quantity. So let's take some positivity from that, and translate that into patience, and recognizing that everybody's doing everything that they can here at our level and on the ground. And in that spirit, I do want to end by with some thank yous and some appreciation. Throughout this last 10 months of the pandemic, we've been tested and we've been challenged, but we really have risen to the occasion in so many ways. At the site today, at our Kingston site, we got a really nice and generous offer, or a donation of support. The Highland Teachers Association chipped in and generously donated lunch today for the 100+ staff and volunteers at our Kingston site. Once again, I wish everybody could be there to feel that energy and the positivity happening at that site, and I'm so looking forward to the day when all of our residents can get through that site or another one of our dispensing sites and get the vaccine and get both doses and begin to move on. So thank you to the Highland Teachers Association. Thank you to all of our staff working at the site, as well as dozens of volunteers that are just generously giving their time to escort seniors to get their shot, to help them get recovered, to help them sign up for their second appointments. Really showing the spirit of service and community here in Ulster County at that site, and in a lot of other ways. And of course, as always, thank you to our frontline workers who have put themselves at great risk in a whole bunch of ways that none of them anticipated a year ago. So thank you to all that are continuing to do that work and to help us get through this and be able to keep our heads above water. We appreciate it. Thank you to everybody for tuning in. Please, if you know a few folks that might not be getting this information, but I'm sure are concerned and interested, think about a few folks in your life, whether it's a relative or a neighbor who might not have access, might not be able to tune in like you or know what's going on. And another way that you can help and sort of spread the word and make sure everybody has this information is to share that in whatever way you can. So please think of one or two folks in that situation. And if we each do that, it'll really help get the message out. I know that the news that we want to hear is that we're getting a lot more doses, and we will get that eventually. But at a minimum, I think it's so important that everyone at least know what's happening, even if it's not the update that you want, just to feel empowered with that information and to know what's going on in a time of such uncertainty is very important. So even just doing that is a great service to your neighbors and to our community. With that, I will wrap up. Our next update will be Tuesday at 3 p.m. Thanks for tuning in. Stay safe and healthy, and let's remain resilient now 3 weeks into 2021, and we'll see you in a few days.